Welcome to the Pediatric Medical Code Education Series. We are embarking on a multi-year journey to revamp and standardize pediatric and neonatal codes across the Advocate Aurora system. Pictured here is the code standardization timeline. Today we will be discussing roles and tasks as well as hot debriefs. Formalized roles and tasks are essential to the efficient and effective operation of a team during a medical code. When a code is called, the code manager, typically a charge nurse, ACM, or senior nurse, will assign the roles and tasks sticker to each team member as they arrive to the code. These stickers serve to assign each team member to a specific role and to identify themselves to the rest of the team. The team leader will also be assigned the Code Team Leader card, which serves as a cognitive aid and further identifier. In this diagram, we present the identification and assignment, as well as the ideal positioning of the top 6 essential team member roles in a medical code. The first role we will discuss is Compressor 1, who will be the first responder to the room wearing appropriate PPE. This individual can be anyone with BLS training, RNs, RTs, techs, or physicians. This role may be exchanged as others enter the room, but the initial tasks will include the initiation of chest compressions with the addition of a backboard as soon as possible. Do not hesitate to ask for a step stool to help. The next role we will talk about is Airway 1, who is the second responder to the room, brings appropriate airway equipment, and positions themselves at the head of the bed. They will then open the airway and initiate bag valve mask breathing with appropriate size mask and viral filter in place as needed at the age-appropriate compressions to breaths ratio. Alternatively, if an endotracheal tube or tracheostomy tube is in place, they will attach the bag and viral filter and deliver breaths at a rate of 8 to 10 times per minute. The Airway 1 provider can be an experienced RT, RN, or physician. The code manager performs the vital task of assigning code roles with appropriate labels, crowd management, and possibly defibrillator operation. This person is typically an experienced RN. The team leader should position themselves at the foot of the patient's bed so they are able to view the entire situation and also so they're in the easiest position for communication to direct the team. The Code Team Leader card will serve as a cognitive aid with the PALS algorithms printed on the card, while also serving to identify the leader and accompany their hand so they can focus on leading the team and not participating in specific tasks. The team lead will typically be the attending physician, ICU fellow, senior resident, or nurse practitioner. The team lead should also review the possible causes of deterioration, order appropriate investigative studies, and perform advanced tasks as needed. If the team lead must perform such a task, they should hand the lead role off to another provider. The recorder is perhaps the second most important role in the effective management of a medical code. This role is typically filled by an experienced RN and involves keeping time, notifying team of events, reporting out lab results, and documenting interventions and patient response. This person typically is also responsible for initiating the hot debrief at the end of the code. The recorder should position themselves at the foot of the bed as close to the team leader as possible. The access role is usually filled by a bedside nurse. The tasks include rapidly identifying available vascular access for medications, fluids, and/or blood products. And if access is found to be inadequate, immediately initiating attempts to secure access through an IV, or if IV attempts are unsuccessful, through the intraosseous route. This person should position themselves at the most reliable point of access, and closed-loop communication is essential to the effective performance of this role. Once the core 6 roles have been fulfilled, the code manager can assign secondary roles to any additional team members who respond to the code event. Some of these roles include airway assistant, pharmacy, code cart and meds, compressor number 2, and compressor coach. Additional supportive roles for the responding team are listed on the slide. Many of these roles assist with code management outside of the patient's room. The next aspect of medical code education we would like to describe is the introduction of a hot debrief. A hot debrief is a debrief conducted as soon as possible after a code event. It will be the responsibility of the unit charge nurse to ensure the debrief takes place, and we would expect the debrief to be led by the team leader or event manager of the code. The purpose and importance of the hot debrief is to give the team a chance to discuss the traumatic event that just took place, collect important data about the event, and most importantly, identify any latent safety threats and opportunities for improvement. Please take a look at the debrief form shown here. More detailed education will be provided to the smaller group of individuals who will be responsible for running these hot debriefs.